restorations, preparation guidelines, shape design, laboratory protocols, and also we're going to review the direct, indirect, and directly indirect techniques for the fabrication of those dowel cores. Also, we're going to speak about multi-unit dowel cores, the indications for that, the shape design, laboratory protocol, and finally, we're going to speak about the cementation guidelines. Okay, so I'm still waiting. Oh, yes, it's already was converted because it was just taking a while until the okay, so I'm just putting this this classification of the different types of prosthetic restorations to see where actually the dowel cores are. So if we refer to the glossary of prosthodontic terms, we'll find that the core is the substitution of the missing hard dental tissues and the pulp. And the dowel, this is the post that connects the core to the root. So basically they are, okay, so I don't know what's going on, but basically those pictures appear kind of a crooked. They're not as they are supposed to be. There is something wrong with the software that converts. But anyway, so just disregard. This one should be, I mean, this one should be straightened up exactly as this one, and it actually appears straight on my original PowerPoint file. I don't know why this software is just making those stupid mistakes. Okay, so they're basically when the only thing that is left is the residual root. So you have to restore this root, but the problem is that in order to put the crown on the surface of the root that has been ruined up to the margin level, you need to have a die. And basically the die is missing because it has been ruined due to the access for the root canal treatment, due to some carious lesions and so on and so on. So basically you have to build up this missing core. But the problem is that generally you need to anchor this core to the residual dental tissues in it. So that's why the core that we need, it can be built, but in fact you need a dowel to anchor the core. So there are two basic options to do this. The first one is to make a dowel core crown, which in this case the crown and the core and the crown, the core, and the dowel are one piece. So, and the other way around is to make a dowel core and to put a crown on the top of it. Which one is better? Probably you will find out till the end of the lecture. There are certain issues that have to be covered in order to make this dowel core not to be just a dowel and a core, but to consider this restoration to be a dowel core restoration. Okay. Because having in mind that that you to assign something as a restoration, that means that it has to be completely functional and fulfill the entire, to restore the entire integrity of the tooth. Okay. So the first thing that we have to review is how long should be the dowel or the post that is supposed to anchor this core. So this is a comparison between the forces of extraction in pounds that are needed depending on the length of the post. So the best or the optimal ratio is to have this length of the core compared to the length of the future crown. It has to be the length of the crown should be smaller than the length of the post. And of course, remember that it's always has to be about 4 millimeters, especially this periapical seal has to be preserved within 4 millimeters. This is an issue that was derived at the early ages of the root canal treatment, where usually resorbable pastes were used. Nowadays, you can decrease this number up to 2 millimeters, but nothing more, because nowadays we use different sealants that are making a chemical bonding, especially into this area. And this is much more durable seal, because the main danger of just decreasing this number is that when you start cementing this and you start pushing the post, there is a greater hydrostatic pressure that it's created. And sometimes this hydrostatic pressure may cause this to dislodge this seal and may cause some serious inflammatory processes, especially if some of the luting agents come out here on this biological width. So you can go in between 4 to 2 millimeters. Most of the cases, if you keep 4 millimeters about this seal, it's gonna be too much. Nowadays, we use a chemical bonding seals in this area, and it is much more safer to decrease. But the other two issues, like the length of the post, should be at least 2/3 of the entire length of the root, but it always has to be corrected according to the length of the future crown. Okay. And there is another consideration that also has to be taken into planning the length of the post, is that basically there are some cases where the root has not been completely covered by the surrounding bone, or sometimes there is thick soft tissues covering it. And if you just extend the tip of this dowel any not deeper than the area of coverage of the bone, basically there is a great chance of fracture on this segment, because the root has been supported by the surrounding tooth supportive system, and it's much more durable and against fractures. So another consideration is to make a periapical and to measure the height of the residual bone, and to make sure that we go as deeper as possible, just keeping in mind that we have to have a seal. And also you have to be completely aware of the fact that all the roots and all teeth that had undergone root canal treatment are 4 times more fragile than the vital teeth. And the fragility usually is been enhanced within the 4th year after the root canal treatment. Okay, it's basically doesn't happen overnight. Okay, so another consideration is the taper. If we make much more, if we make a lot of preparation on the internal surface of this root, basically we're going to have the forces sitting here and trying to just split this root. So basically we're going to consider the taper and also the amount of the preparation. If we make very thin preparations, we might end up with some mechanical failures due to the bending of the material. And this is an endless time that I should emphasize that basically those principles have been built and have been derived from the, let's just call it the old school principles, because most of the cases, those dowel cores were made of, they were cast from dental alloys. And nowadays, it's not quite appropriate to use especially metal alloys for those kind of restorations, because the first issue is that there is a great discrepancy between the modulus of elasticity on any dental alloy and the vital structures, and especially dentin. And but those general principles are always valid in most of the cases. And if you just follow main of those principles, you have no problem just replacing them with the much more sophisticated materials. Okay. Another consideration is that the preparation should not be too bulky, because you might end up with a root fracture, or if you just make smaller preparations, always have in mind that you might end up with some mechanical failures on the dowel. Okay, and another consideration that has to be taken into mind is that, speaking of a dowel, basically we have different options for that. We might have a straight wall or a parallel sided dowels, and we might have a tapered sided dowels. And in terms of fixation of that, it could be serrated parallel-sided dowel into a straight wall preparation. The other option is to have a smooth dowel with a parallel-sided, non-threaded preparation. And finally, you might have a threaded dowel into a threaded preparation, and the cement is just filling the gap in there. We might have the same 3 variations on the tapered sided preparation or root. And actually, in order to consider which one is more beneficial in terms of retention, I'm gonna present you this comparison. So basically, the tapered dowel that is just passively inserted, it's the tapered dowel, has the smallest force of retention. The serrated parallel dowel is this one. So it's serrated parallel dowel. And the threaded parallel dowel, you can see how much retention you can gain, especially that's C. So, what is the conclusion about this? Let's just go back on this. Let's go back on this. Okay. So, not in any case you will be able to make or to get this length of the preparation. Especially when you're restoring upper laterals or teeth that have shorter roots, and still you might have the necessity to consider or to restore a longer crown. And if you end up with unbeneficial ratio in cases like this, the only solution to resolve this issue is to disregard these proportions, but go for something that it's much more retentive. In this way, basically, you are going to be able to reduce the length and still keep this restoration within the reasonable build-up guidelines, because not in every case you're able to make this kind of preparation. So that's the point of having in mind what are the options to transform those cases when you're not able to have enough length for the restoration. Okay. So now let's take a look on one of the main stages of the preparation. The first thing that you have to remember that when you have non-sufficient amount of dental structures sitting above the gum, you should reconsider whether you need to make a dowel core or you can just keep them as they are. In most of the cases, you have to get a certain idea how big should be the die that you need to have this crown on. And for this reason, you have to keep all the all the residual structures. In this case, basically, you just start preparing the tooth for the crown, and all the areas that are not properly restored, then you can just restore them. Okay. So there are two general approaches in this case. The first thing is just to get rid of all the structures that are sitting above the gum and to have a flat surface, easy to work, easy to access, and then you can just make this dowel core and then you can put the crown on. The second approach is to make a very meticulous preparation and to keep all the residual superstructures that you don't have to remove, and then to build up only what is missing for the future crown restoration, and then to put the crown on. So this approach, of course, is much more beneficial because the crown itself creates something that it's called the ferrule effect. So this is the effect of embracing the residual structures, because any post, especially the posts that are made from dental alloys, they tend to fracture the residual roots. And by removing all the supragingival structures at the margin of the level is going to uh, reduce the chances to get this ferrule effect. And in terms of this, this is the time where I would like to emphasize that creating this ferrule effect, or the ferrule effect, is something that it's considered to be the third component of any dowel core. This is a functional component, which means that this is something that you cannot see, but if it's not there, you will see the consequences of what is missing. And if we go back a little bit on the previous slides, let me just find the appropriate slide. Okay, yes, so that's a good one. So now, what we have learned so far, you have the the core, you have the dowel, and if you see those bevels here, those tiny bevels. So in this case, basically the core itself is going to create something like a minor ferrule effect on the residual dental structures. And of course, once the crown snaps on, it's going to create additional ferrule effect on these areas. Okay. It could be created even if you use this dowel core crown, but it's always mandatory. So what we have learned so far, that the third component of any dowel core restoration is considered to be the ferrule effect. Okay. You see everywhere. You should be able to, or you should try to keep this ferrule effect, the effect of embracing the residual structures. And of course, which one is the fourth component of any dowel core restoration? Because most of the roots are closer to a round preparation. So there is always a chance that you will need to stabilize the dowel against the forces of rotation, because we know how to stabilize the dowels against the forces that are trying to pulling it up out of the root. But there's still horizontal forces, and for this reason we need to make something which is assigned as a counter rotational component. You see those tiny grooves in here and in here, and of course the shape of the canal is made in a way that it should provide a counter rotational component for this for the dowel. So the fourth component of this is the counter rotational. We'll get back to this, but now let's just go back for this ferrule effect. From what we have learned so far, do you think that it's always mandatory to make this ferrule effect? Can you go around without providing this ferrule effect? Is it possible to just disregard these issues? Okay. Can you just... Okay, so in order to answer to this question, so I would like to present you, this is research done in 2011. There were 5 groups of restored heat. The first group has no dowel, just a composite restoration and a residual surrounding wall of 1 millimeter height. The second group was having a height of 1 millimeter and a dowel, and these are the other groups with different heights of the residual walls. And this group has no ferrule and a composite restoration. So those roots were loaded and they were tested for the fracture resistance. And basically the result showed no significant difference in the fracture load resistance within the groups. So the reason for that is that those teeth were restored not with the metal posts, but with composite fiber, glass fiber reinforced composite posts. So it's not the ferrule that makes the difference. It's the type of the material that we have used for the restoration for this tooth. So which means that in cases when you don't go for the classical post and core restoration, and if you don't go for a dowel core that it's cast from dental alloys, you can disregard this issue about the ferrule. The reason is that those composite fiber reinforced posts, they are built in a way that their physical properties should mimic the presence of the mechanical behavior of the residual dentin. And in this case, you can expect that there should be almost no discrepancy on the mechanical, on the behavior, especially in terms of mechanical properties for those posts compared to the posts that are cast from dental alloys. Okay, so this is so the answer is, can you just disregard this? The answer is yes, if you're not using a metal alloys for this kind of restoration. Okay. So once you have prepared the residual walls on the on the root, you have to go for the canal preparation. And of course, what is important to do that, always have in mind the periapical seal. And so this, you have to try to keep it within 4 to 2 millimeters, depending on the kind of the, on the type of the filling material. And another consideration, which is also very important for you to know, that they are an average width of each canal, and you have to respect the distance between the preparation and the outer contour. And speaking of this, you have to be familiar with the outer contour of this root. Of course, these are averages, but there are some areas that are considered to be as safety zones. And especially if you take a look on this, on the cross-sectional area of this root, can you guess which tooth is this? Because just by looking at the cross-sectional area of this crown, does anybody can guess which exact tooth is this? Yes, basically, the main benefit of knowing the anatomy and morphology of teeth is that you have to remember that there's certain specific areas And of course, the cross-sectional, knowing the morphology of each tooth, you have to remember what kind of shape you get on the cross-sectional areas. And of course, this is a very remarkable depression that could be seen on the mesial side of the upper premolars. Uh, and you always have to think about this. So if you go for this kind of preparation, basically you're going to endanger this area. And there is a proof for that. And the proof is that this is the upper first premolar is considered to be the number one tooth in incidence of fractures. So usually it's been lost due to the presence of those two roots. And the reason for having two roots, I think we have discussed that fact at probably at the lecture of the tooth eruption. So there is a strict correlation between between the fact of the eruption of the canine formation and why do we need to have this first premolar having two roots and the second one is with one. Okay, so let's just get back to this. You always have to respect the type of the preparation in order to be consistent with the outer contour and the morphology of the root. And for this reason, this is a schematic that it actually represents which are the safer kind of preparations. Speaking of this, it is very important to outline that those kind of preparations and those kind of double course are assigned as anatomical preparations, which means you have to follow the external anatomy or to follow the internal anatomy of the roots regarding the safer zones. So there are certain groups of teeth where you can use this round preparation, although it's not always beneficial to have a round preparation because that's gonna just reduce the ability to get this counter rotational unit. Because if you make a preparation like this or like that, and especially like this, you don't need to make those grooves and you don't need to create a separate counter rotational units because once just following the anatomy, you're going to create the counter rotational component for this post by itself. Okay, so that's another consideration. And if you're not quite sure that you have made your preparation in order to be fully providing the options of stabilizing this root against the forces of rotation, you have to make some notches or some grooves that are going to act as a counter rotational component. But if you make an anatomical kind of preparation, you see, you can do a preparation like this and you don't need to make any separate counter rotational component. Okay, so how do you restore teeth with multiple roots? Of course, you can restore them by two ways. The first way is to make a parallel, or even it's much more beneficial if it's like slightly tapered preparation. This is an upper premolar, and you always consider the path of insertion of this. And by preparing the roots, you're trying to get this parallel wall, this wall to be parallel to this one. If you cannot do this, of course, in the lab, they can do it. But in cases when you have multiple roots engaged into a one-piece restoration, you can skip the part for creating the counter-rotational component. The only component that you would like to do is just to create the ferrule effect. Okay. If you go for the preparation of teeth that have a greater divergency into their root system, the one way around is to do it like this, just to use one of the roots, which is much more easily accessible, or to try to make your preparation parallel. This kind of approach has some downsides that I'm going to consider a little bit later on this lecture. So for that, just you will see the downsides of this. Another option for having those counter-rotational units, especially when you go for a tiny when you go for a teeth with a tiny roots, with very tender and fragile, you can use mini posts, but those mini posts should be completely parallel to the main one, because if you finally you have to cement them, and if you're missing some of the parallelism between this supplementary post and this one, basically you won't be able to insert it. So for this reason, this specific 8 has been used for the parallel preparation on the accessory canals. So this one goes into the main canal and always keeps the burr parallel to the main canal preparation. Okay. So finally, once we finish with the internal root preparation, we have to make some additional adjustments. If you end up with tiny thin walls, of course you can take an impression and you can cast a model, but due to the processing of this, there is a great chance that you might end up with a fracture of those tiny walls, especially on the plaster model. And then the problem is going to be that you're going to get this double core cast on a model that has been deformed, or some parts of them are missing. For this reason, well, this slide has been crooked again, and this is, I don't know what's going on, but probably this is some kind of issue from the system that I'm uploading the slides, because they appear to be into the right direction on the lecture, on the PowerPoint file. Okay, so it's always beneficial to reduce the thickness actually to increase the thickness of the residual walls by going and making some additional preparation and making sure that you have at least 1 millimeter residual thickness of the walls. And this is going to be the judgment point, how much you should reduce from the length of your root. Because if you end up with very thin margins, you have to reduce them. You have to flatten them down until you get at least 1 millimeter thickness, which is safer to be taken the impression, and it's safer to be cast from a plaster. So this final sophisticated preparation form has been created step by step following the guidelines for the preparation. Of course, the labial site has been prepared according to the rules for the preparation for a full crown. The internal part has been prepared according to the preparation for following the guidelines for minimum invasive preparation, and the internal main canal with the counter-rotational component and the ferrule effect. This counter bevel is just to reduce the chances for fracture or chips off from the plaster. Okay, so then what's next? Basically, there are three different ways that you can get this double core done. The first way is, once you have finished the preparation, you can use a metal post or any other kind of material for a post or plastic post to stabilize this. You can use acrylic or wax in order to fill the internal part of the root and make some kind of like a rough preparation, some like a rough wax up. Most of the cases, it's much more beneficial to use special resins like patterned resin or some other acrylic products that you can mix. You can fill the canal, use this post to stabilize them, and make the direct preparation inside the patient's mouth on this material. Prior to this, you have to make sure that you have properly isolated this surface so that you can just get this post out and you can directly send it to the lab, and they can just put it on the casting cone, put some investment material, and cast it. In this way, using the proper material for the fabrication of this dowel and core, you can directly convert this material into the exact same size and shape. Okay. What is important for you to remember is that because in this case you haven't provided enough space for the cement layer, you have always to make a groove on one side on this post. So when you put the cement inside, you should just give a path of passive evacuation of the excess of the cement, because otherwise you might end up with either root fracture or incapability of proper insertion of this dowel into the right position. And the reason is that you haven't, basically there is no chance that you can use a spacer here for the cement. Okay, you can do this canal either prior to insertion or after casting, but in most cases you have to do this before the cementation. The second approach is to take an impression. You can take an impression after the preparation using a flowable silicone and Lentuo to fill the internal area, making sure that you don't get any air bubbles trapped inside. You can use an additional post to stabilize this, or you might not use it. It depends on the hardness of the silicone, because nowadays we have silicones that have higher numbers for hardness in Shore A. So if you have a silicone that has greater than 65 hardness according to Shore, you can just skip this part because sometimes it's much more difficult to align this post when it's there. So most of the cases, it's always preferable to do it without it. Okay, and fill the tray and take an impression. Okay, so then you just send it to the lab, and the lab are going to cast a plaster model from this impression. This is the negative copy that we have created. And then the lab technician can use here a spacer in order to provide enough space for the material. You can use the same approach using the pattern resin, or use wax or any other material that generally has been used for this. And then it's been inserted on the casting cone. You can skip this. You can skip this part, or you can always just do this canal just in any case to secure the preparation, to secure the cementation. And then when it's done, you can cement it, take an impression, and make a crown. And this approach is the indirect technology for fabrication. And we have one more, which is called the... We have one more topic to cover, which is the indirect two-piece double core. So you remember that I told you that using or making double cores on teeth that have a greater divergency into their root system could be done like this, or could be done like this. So this one is a no-brainer, basically, because you have the chance to get certain parallelism. But the problem is when you have a greater divergency using one of the roots, okay, and the other one is just to get a slight preparation is one of the options. What are the consequences for that? The masticatory forces. If you go for this kind of, this is, let's just, so this is a lower molar. Basically, the occlusal forces are coming into this direction. And any of those roots will be loaded mainly on the long axis. But for the upper teeth that actually have a greater divergency on their roots, and this is mainly because here in between you have the sinus cavity, and they have to just try to put their roots on the bony substructure, which is not in the middle area. This is on the long axis here on the velar ridges. So the occlusal forces are coming into this direction. And in most of the cases, that's going to create some lateral compression on the root that has been predominantly used for the main post. And this can create a certain danger for fractures, especially on the root that you have prepared. So for this reason, it's more beneficial to try to use and occupy all the roots, or as more roots as possible. The first problem of this is the taking of the impression. It's kind of a tricky if you want to use the direct technique for this, because you cannot just take out the acrylic that has been hardened inside the canal. So it's mainly used with this kind of technique for the impression material, and especially with elastic silicones. Once you cast the model, you have to make this dowel core into two pieces, because that's the only way that it's going to resolve you the problem with the diverging roots. So this is the model, and this is the one piece of the build-up that you can just do. And once you cast it, or prior to casting, you can make some additional canal preparation like this. And when you cast this, you can just insert it on the model, and then you can make the other piece. So at the final stages of already finished restoration, it's going to look like this. You're going to have the path of insertion of one piece that goes in and snaps and gets to the right position. And then you can get the other piece that it's going to lock on. And the only tricky part is that you have to cement them, not one by one, but you have to cement them at once, which means you mix the cement, you fill the canal, just put this part, and then before having the cement set, you have to put the other one. So that's how you can restore those teeth. Of course, this is a general principle, and you can make different variations of those kind of dowel cores. But the general idea is to evenly distribute the load of the occlusal forces on all the residual roots. And due to the divergence of the root system, you can apply this approach using a two-piece disassemblable dowel cores. Okay. And the final technique that I would like to draw your attention on is the directly indirect technique for fabrication of dowel cores. Because so far we have reviewed the technique for direct fabrication and indirect with an impression. But what is directly indirect technique? The directly indirect technique is to have the internal preparation as it is shown, and to make those accessory canals as an additional counter-rotational unit. But here you have to put the post from the same kind of material that you're going to get the core on. And of course, those retention pins also have to be inserted from the same kind of alloy that you're going to make the casting. And then you put the acrylic, the pattern resin or the acrylic, and you make the preparation. Then you're good to take this out, keep the same pins, and just cast this part. So it's only the core that has been cast. The posts are going to be exactly the same as they are. This method is very beneficial, especially in cases when you have shorter roots, and in cases when you have those preparations so tiny that basically there is no chance to take an impression from that. So you have to get the same kind of wire or the same kind of material that we're going to use it, and just to assemble all the posts and cast the core that is going to combine the roots. Okay. You can make a dowel core under a crown. Of course, there are cases when for some reasons, teeth that have been weakened by carious lesions or by too many fillings might end up with a fracture. And especially if it's a brand new crown, you have a problem that basically you either have to make a new crown. In cases when you want to keep this crown, after the root canal treatment, you make the same kind of preparation that you have to do for a new crown, but just fill. Once you finish with the preparation, you fill the internal side of the root, fill it with the acrylic, put the post on, and then you use the same crown that the patient was having, and you can fill it with some additional material and put the crown on. After the setting of the material, you have to remove the excess of this, and you can just take this out, remove the crown, and cast this core that has been shaped by the presence of the internal walls of this crown, and you can cement the original crown that the patient was having before the fracture. Okay, and there is one more option to make a double inlay in crown repair. Sometimes the patient might need a root canal treatment on a tooth that was initially vital, but then for some reasons this tooth had undergone treatment, root canal treatment, and then this the root canal treatment itself might weaken the tooth, and the crown might be endangered from a fracture. So in this case, you can make the preparation through the access channel that was initially used for the root canal treatment, with the only with the technique that you're using. You can take an impression from that, and then you cast a model, and finally you have something like an accessory post that could be used to enhance the stability of this crown. Nowadays, this has been considered as an old school technique, because in most of the cases you can use one of the adhesive posts or the adhesive techniques to get the same benefit. So so finally, this is how this entire build-up would look like. And at the end of the lecture, I would like to summarize one of the main important points that we have discussed today. So speaking of the main components of the double core restoration, you have the core and the post. Of course, these are no-brainers because you can see them, you can outline them. But what you cannot see is the ferrule effect, because it's a functional component, and the counter-rotational unit, which is also a functional component. You can sense it if it's missing, but sometimes you won't be able to recognize it. It could be incorporation of accessory canal preparation. It could be this one, it could be this one, or it could be the classical counter-rotational unit. Any of those kind of preparations could be considered as a counter-rotational unit. Of course, having in mind and following the internal anatomy and morphology of the internal root structure is going to give you the counter-rotational component. But always think about it, because it's a functional component of this entire restoration. Ferrule effect. Ferrule effect, it's always mandatory to be present in any case when you're planning a metal alloys double core restoration, and it's not necessary to be used when you have a composite restoration and a composite post restoration. Okay. Preparation. You should prepare as less as possible, having in mind that you at least have to provide enough durability for the material. The length of the post should be higher or equal to the crown length. Can you disregard this option? The answer is yes. How can you do this? By changing, by changing the type of the post and the fixation. But in most of the cases, that's very important. And anatomical restoration. Respect the anatomy of the root. Think about the danger zones around. Think about the danger zones and think about the morphology. Okay, so that's the end of the lecture, and that's the end of this course of lectures. If you have any questions, you can just post them. If not, just be safe, and hope to see you next year. Hopefully not in the Blackboard, but whatever the conditions you might encounter, we shall react adequate. Okay, thank you for attending this lectural course, and be safe. Yes, the answer is all the lectures will be uploaded once we have finished this course. So there is a question. So does the diameter of the preparation depend on the burr you choose? Yes, of course, but usually you should choose the burr, the diameter of the burr wisely. In most of the cases, the general idea is to, because nowadays the root canal treatment is trying to be as less invasive as it's possible. But when you just follow the preparation, you should try first to remove all the residual root canal filling material. And in most of the cases, once you do this, this preparation is going to be good enough for you to restore it. The only problem is that due to the root canal treatment, you might end up with some over-prepared areas that you don't need to go especially into that deep. There are different techniques for restoring the over-prepared teeth, and it's called internal root rehabilitation. That's a technique that it's a combination between different types of composite restorations. But within the past, I would say 15 years, all those metal double cores considered to be the old school. Basically, I can speak on that matter probably for, I don't know. This is the double core restorations was the topic for my PhD thesis. So there are a lot of things that they have changed within the past years, but have in mind that this is the preparation guidelines that are valuable, that are still relevant. But you should avoid using the dental, especially dental metal alloys. Nowadays, within the past 15 years, it's always much more beneficial to go for the adhesive techniques, which is a philosophy derived from the failures that were recorded within all those years. Because no matter what you do, no matter how you prepare, this is probably the most beneficial way of restoring teeth, having in mind that there is a great benefit that is coming by the replacement of metal alloys, which are not the best solution for this. Using zirconium posts is neither a beneficial implication. There was a great influence somewhere in the beginning of the millennium, and there were a lot of zirconium posts on the market. They are not a good solution. So the best way is the composite restoration, because there is a way that you can, by depending on the proportions and the different kind of preparation or the fabrication technique, you can tune up the elasticity, you can tune up the the mechanical properties in a way that they should be as close as possible to the natural dentin. Okay, so that's the best way to restore a tooth. Otherwise, all this information that was given in the lecture was something like the development of the general principles and guidelines for the tooth preparation. But mostly you can follow, if you follow these guidelines for the preparation and you use the proper material, probably you're going to reduce the incidence of fracture. Okay. Okay, so there was a question. Let me just. What about the lectures from the last years as well? They were uploaded and now they are gone. Yes, of course, they are gone because they were not consistent with your program. So the easiest way to get the most relevant information is to just get rid of all the residual old versions of copies. If you just go for Windows 10, there is no chance that you can go back to Windows, whatever previous versions that you might have. So that's the reason that we have erased all the information that it's irrelevant. And sooner, once we are ready with the fresh update on the lectural course, it will be uploaded. I'm sure that you're still sitting far away from your exam, so don't be in a hurry. Once we have revised the entire information in order to be consistent with your with your brand new lectural course, it will be accessible online. Okay. Okay, so if you have any other questions, please write them in the field below. I'll be online till 9 a.m. So if something shows up on your mind, you can just post them and I will try to answer that.